Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. Joining us today is Dr. Sina Pourtaheri, an orthopedic surgeon at Gulf Coast Orthopedics and Terrebonne General Health System, and his patient, Ronald Stone. Thank you for being with us, guys.
Thank you.
Thank you.
I'd like to welcome you to the show, and let's get started with you just telling us a little bit more about yourselves. Dr. Pourtaheri.
I'm a fellowship-trained orthopedic spine surgeon. I do spine surgery at Gulf Coast Orthopedics.
Okay, and Mr. Ron?
I am a twice retired Presbyterian pastor, for whatever that's worth, and I am happy to be retired as well and to enjoy the good health that I have and to hang out with my wife. I like doing that with her.
Oh, well, that's wonderful. And we're going to learn a little bit more about your story.
Okay.
We are going to talk about adult scoliosis and surgical treatments here at Terrebonne General. So let's get started with asking Dr. Pourtaheri, what is scoliosis in adults and how is it treated?
Yeah, so adult scoliosis is scoliosis or curvature to the back related to degeneration of the disc. So the disc can asymmetrically degenerate, which develops a coronal tilt or curvature of the spine with rotation. In adolescence, it's different. It's not related to degeneration. They develop more of a sweeping curve, and it's usually started between the ages of 11 to 13 years of age. Adult scoliosis has pain in terms of back pain and sciatica. Adolescent scoliosis generally is asymptomatic in the sense they don't have symptoms, just a curvature to the back. So adult scoliosis is more related to aging the spine, degeneration, which happens more in the ages of 50 and 60 and progresses. Adolescent is more diagnosed between the ages of 11 and 13 and not related to degeneration.
And that's where Ron comes in. Can you tell us what kind of mobility issues you were having?
Well, I was in a lot of pain. A lot of it is due to having celiac disease, which I was allergic, still am, to glutens like wheat, rye, barley, and oats that have been processed with wheat. So I have to watch my diet, but I also, in the process, with this being a genetic thing, my sister, my niece have also been afflicted with that. I had a lot of stiffness, soreness, and there was a lack of calcium in my bones as a result of that. And so I had to be careful about what I would pick up, nothing over 10 pounds. And even with dog food, I have to drag it along the floor. So
that's how it affected your daily
it did. It did.
Ron was your patient. He was diagnosed with adult scoliosis. And tell us a little bit about, how common the treatment is for adult scoliosis.
It's pretty common in terms of adult scoliosis. For Reverend Stone, he had multiple surgeries for it. So it's a difficult problem in terms of it, and it can cause a lot of disability. The big problem is that they have a lot of fatigue of their back and they can't walk a far distance due to the dysfunction in terms of their alignment and their ambulation issues. It also affects their health pretty greatly, both mental and physical. And there's a lot of studies that the people that had prior surgery with scoliosis and still have significant curvature to the back and are imbalanced. The burden to their health is equivalent to having diabetes, stroke, and heart disease at the same time. So it's a very disabling condition in terms of adult scoliosis, particularly people that have had surgery and still have significant curvature and still having significant disability in terms of back pain and sciatica related to it.
Are there minimally invasive procedures involved, and what are the benefits of that as opposed to open surgery?
In terms of minimally invasive surgery, it's my preference. There's more and more minimally invasive surgeries becoming popular for different spinal conditions, but particularly with scoliosis itself. Traditionally, scoliosis surgery in adults is a large incision where you put multiple anchor points from T10 all the way to the pelvis to essentially realign the spine. In his case, for his index surgery, looking at it, my preference would have been minimally invasive, where essentially through a small incision on the side and small incisions in the back, you correct the scoliosis, and patients with that can go home same day from surgery, or the following day for that. But the technology is getting better and better in terms of treatment for not just scoliosis, but spine conditions. And so they're more effective techniques. And minimally invasive, the technology is improving, so we can give patients more quicker recovery and also a better result with lower complication rates.
Yeah, I know that's what patients are looking for, quick recovery. What is involved with a spinal fusion?
So spinal fusion is where you put implants in the back to essentially address the instability they have of that segment that's desired to fuse. So you put implants in the back and basically heal it together to address the instability they have of those two segments of the vertebrae.
And when is surgery considered necessary for scoliosis?
Adult scoliosis, the main indication for surgery is disability. Adolescent idiopathic scoliosis, patients that don't have any pain or sciatica associated, so they don't have any symptoms. They're essentially asymptomatic. So the indication for adolescent scoliosis is more about the curvature and for cosmesis and preventing issues in terms of preventing the curve from progressing. And adolescent scoliosis usually benchmark surgery for a Cobb angle or amount of tilting of 45 to 50 degrees. In adults, the main indication for surgery is disability, because when they have the degeneration of the spine, they get back pain and pinched nerves. So they have disability from both the combination of the instability and curvature of the back, but also related to the neural elements being compressed. So the main indication for surgery is disability, their symptoms. It's not so much the amount of curvature, which is adolescent idiopathic scoliosis is mainly based off the amount of curvature. In adults, it's more based off their symptoms.
Can you actually see that curvature?
Yeah, you can see the curvature of their back. We do an Adams forward bending test, and so you can look at the curvature in terms of rotation of the spine and seeing a hump of the thoracic and lumbar spine showing the rotation, and you can clearly see the tilting of the spine with it.
What should patients consider when they're deciding on whether or not to have a scoliosis surgery?
Adult scoliosis surgery, I think the main indication is going to be symptoms or disability. So if you have a lot of disability where you're chronically dealing with back pain, can't walk a far distance, or limited in terms of how far you can walk before you get sciatica and back pain, I think that's an area where you could consider surgery, but I would always try to do conservative treatment, because my approach is always conservative. So if you do conservative treatment and still having pain and still not doing well, that's consideration. But then also people that have had prior surgery that are globally very tilted off. The study shows the amount of disability that causes in terms of their health and mental function. In those cases, conservative treatment in those very severe cases is not that effective in terms of treating it.
Okay, Mr. Ron, is that kind of what you were having, some disability and pain, and were you nervous before considering this surgery?
I was not really that nervous. I had had a couple of surgeries prior to being with Dr. Pourtaheri. One was Birmingham, which was successful, cervical discectomy that went very well. But then I had another surgery that was not so successful, my lower back.
Mm.
And so I talked with a physician that I've known for a long time, surgeon, who recommended Dr. P. And I said, well, if you trust him, I do. And so I really wasn't dubious at all. And I was happy to go to him. And it's been a blessing ever since.
Dr. P, what is the recovery process like?
So it depends if it's being done minimally invasive versus open traditional, the amount of levels fused. So if it's done minimally invasive for smaller curves, less than 50 degrees, you can some of those patients you can send home same day or 1 to 2 days after surgery, doing a minimally invasive technique for it, if it's possible for those patients. And then generally they could go back to work, depending on the demand of their work, between 2 to 8 weeks, depending how demanding their job is. More open traditional, large revision surgeries, patients generally will stay in the hospital 5 to 7 days. and could return to work between 3 to 6 months, more closer to 6 months. So it depends on the magnitude of the surgery done and how it was approached. Minimally invasive surgery generally has less recovery because there's less disruption of the musculature and natural anatomy, so they have a quicker and easier recovery. But not everybody it can work for. So in select patients where it can work effectively, the recovery is quick and quicker than if you did it a more of an open traditional way.
And what was your recovery process like?
I listened to the doctor as to what I could do and couldn't do, but he was also magnanimous in saying that do what you feel like doing. I've done some whitewater canoeing. I've also traveled to Europe twice in the last year with my wife. I had 9 magical days in Ireland, our first cruise ever on the Rhine River in Middle Western Europe. And
Sounds
I
beautiful.
drove here from my home in Mobile yesterday all by myself through Kenner during rush hour.
Okay.
So I'm here and feeling well. I don't have any complaints at all. Not much pain at all. Hadn't been for a long time.
That's wonderful. So I was going to ask, how has your life changed since you've had the surgery with Dr. Pourtaheri?
Well, I can chase after my grandchildren. At 71 years of age, I can't keep up with them, but I try, and I'm glad that I'm encouraged to do whatever I can do, and I can spend time hanging out with my wife, Judy, who's been an angel in all this process. She really has been, and so she took good care of me, and the physical therapist came to our home and took care of us, and so.
So why would you recommend Dr. Pourtaheri as a great surgeon?
Well, because I'm taller than I used to be, and because I don't have the pain that I used to have,
That's a great one.
and I'm encouraged in every way about recommending other people to him because he's got the expertise and great bedside manner as
You
well.
can't beat that. How can someone schedule an appointment with you, Dr. Pourtaheri?
They can call Gulf Coast Orthopedics phone line and schedule an appointment.
Okay. Well, thank you so much for sharing your story and both of you for being here today.
Thank you.
For more information about spine surgery at Terrebonne General Health System, visit tghealthsystem.com. Thanks for joining us today. Don't forget to like, share, and subscribe to our podcast where you get your podcasts.